Hey there, I hope you're having a beautiful day, and we are going to talk about the developmental impacts of intergenerational trauma. So this is really important to understand for both working with the caregivers or the adults as well as the children, because they can kind of co-vary and affect each other in a pretty significant way. So I'm going to get my slides up and we will get started. And here we go. Amazing. So this is step 3 of the Intergenerational Resilience Method. And the Intergenerational Resilience Method is a collection of interventions that are organized to create an efficient and effective system that addresses the impacts of intergenerational trauma across generations. And it's really important that it be efficient and effective because these families have dealt with these difficulties for so long that they need relief quickly, and they need to feel that there's some forward momentum and progress that they're making so that they're more motivated and they stay in therapy and get the support that they need. So this, again, is the Intergenerational Resilience Method. First, we improve regulation. Second, we move towards earn-secure attachment. Third, we support development. And fourth, we build connection and resilience. So working on the support development today. So what we basically do to support the development, we first want to assess any developmental impacts. We want to address the child's unresolved trauma. We want the child to have an increased sense of felt safety. We want to improve the child's earned security, and we want to decrease the behavioral impacts. And that lowering of behavioral impacts is really like the main goal, because that's probably what the parents are struggling with, what the schools are struggling with. But we have to do this. We have to clear out all these other impacts in order to get the impact of trauma and intergenerational trauma to not cause behavioral disruptions. So the first step is to assess developmental impacts because it affects both the parent and the child. If the parent experienced trauma themselves when they were growing up, they will have some developmental impacts potentially. And then we want to know where they are in the child, because sometimes they can influence each other and they can be transmitted not only in the experience of attachment and dysregulation, but through the relationship with the parent and in the environment as well. So assessing these is so critical for ensuring that you can really tailor interventions for the child and really hit the things that they need. So the assessment domains, we're going to go really wide with Erickson's stages of development, and then we're going to go narrow and we'll look at attachment, biology, emotion regulation, dissociation, behavior disruptions, cognition, and self-concept. So let's get started with Erickson's stages of development. So the first stage is trust versus mistrust. It's from birth to 1 year old. So the infant experiences the world really through relationships with the caregiver, that connection, their attunement to the child. And they learn that the world is a good, safe place when this developmental stage is met. But when there's developmental disruptions during this period, the person may, through life, if this isn't addressed and isn't taken care of, they can be very suspicious. They don't trust people. The world isn't a good, safe place. There's some withdrawal because they have to kind of self-protect by pulling into themselves. And there's a fear of the future. So there's never kind of forward thinking that's positive. It's always fear and worry and overwhelm. So the second stage is autonomy versus shame and doubt. And this is from ages 2 to 3 years old. And this is where the child, again, they're exploring the world. They can start walking during this time, start realizing that they're a separate person, and they go out and explore kind of away from the caregiver. Then they come back. When it gets a little too scary, they return, they have that secure base, they can go explore again, and then come back again. So when these tasks are met, the person will have self-esteem and independence. First, the world is safe in the first stage, and then they can go out and explore. They feel good about it, and they are independent in doing that. So when trauma impacts this stage, there can be really deep shame and self-doubt. And this is really important because in intergenerational trauma, shame is a very significant factor that has a tendency to be transmitted through generations environmentally as well. So it may be the parent experiences a deep sense of shame, and the child will as well, because there's not that feeling of self-esteem and independence. It's not possibly encouraged in the family or the environment. There might be so much chaos that they really can't develop these qualities. So we want to be really careful with this stage as well, because when so 2 to 3 years old, there's typically not language developed. So a lot of the memories that people will have from this age are what we would call implicit. So they're not conscious, they're below conscious awareness, but they're in there. So it might be that there was something really scary that happened with a dog between ages 2 and 3, and now the person has no idea why, but they just can't be around dogs because it makes them way too anxious. So when we work with people who have had disruptions from this 2 to 3 years old, they may have pretty significant emotional experiences, but they can't link where it's coming from or why they're having it. It might just be an overwhelming sadness, overwhelming self-doubt, or shame that there's nothing attached to it in the environment that they can say that triggered it. And it may be related to this age 2 to 3 years old, if events happened that disrupted this stage and they've developed that sense of deep shame or self-doubt. So stage number 3 is from 4 to 5, and this is initiative versus guilt. So during this period in early childhood, they're further exploring the world and the environment. They need consistent, stable caregivers to meet these developmental tasks. So when they're met, they're self-directed, they have a sense of purpose, they can go do things, they start to think a little bit deeper and start to get curious and explore. But when there's disruptions, the person may have a lot of guilt. They may not have that ability to go out and be self-directed because they don't feel good enough, or they don't feel like they can go out and explore and it will be safe. They may have a lot of anxiety because to them, the world just isn't a safe place, and they don't have the relationship with caregivers that they can come back and get back to that secure base. And they may be very inhibited. So they might be shy, might be like unable to activate to do certain tasks and activities. So they are slow to get moving, and it's hard to motivate them. Very important because they're entering school and preschool during this time as well. So from 6 years old to puberty or teen years, there's industry versus inferiority. And this is where the child's like really accelerating their learning and growth. They're learning in school, so they're learning intellectually, cognitively, and they're also learning socially. They're developing friendships, they're meeting adults outside the family system in the school setting. And the family, school, and social interactions are what helps these tasks kind of come to life and helps them meet this developmental task. So when they move through this successfully, They're achievement oriented. They'll go out, they'll want to work on something, they'll be driven and motivated, and they'll have a sense of competence. So they can withstand making mistakes. They can withstand not doing something exactly right and being corrected or taught how to do it again. But when there's disruptions, the person may feel very inferior. So they're not good enough. They can't do anything right. Why try? And they may feel very inadequate too. So they may compare themselves to others, other children, and see that they just don't measure up. So this is kind of one of the roots of really negative self-beliefs. And they usually develop between these stage 3 and 4 between about 5 and 7 years old. So during adolescence, the wonderful world of adolescence, the tasks are establishing an identity. And if you can't do that, the teen ends up having kind of role confusion or not really a good sense of self. So this is where they're defining themselves with a separate identity from their parents. They're starting to see who they are. They start to make choices that sometimes aren't the best, or they're kind of like confusing of like, what happened to my child? They never liked that music or that style of clothing, and all of a sudden they've just like changed overnight. Well, it's this sense of identity. And that sense of identity is linked into their peer group and the groups that they belong to. So if they're in sports or music, or if they go to any kind of activities, it's those places that are going to help them form their identity. So when they meet this developmental task, their self-image is integrated. It's a consistent whole. They're kind of the same person between these different activities, but they're able to have different facets. When there's a disruption to this stage, there's really a lack of identity. They don't know who they are. They don't know what they value. They may be confused about this. Their self-image may kind of come and go and be very different. They may kind of go to one peer group and be in sports at one time, and then the rebels at another time, and then all these different changes because they can't really get their identity and who they are, and they don't have a sense of belonging. And this is really important. It builds for the next phases where they end up deepening relationships. So adolescence can be a really difficult time, especially when there's those developmental disruptions. So these two are older, so they're early adulthood and later adulthood. And these are important for when we're working with the adults as well in the family system, and it may be the parents and the grandparents. So the 6th phase is intimacy versus isolation, and it's early adulthood. This disruptions at this period, the individual feels like isolated. They don't feel like they have deep, loving relationships that provide that soft landing place when things go wrong. And they end up being kind of lonely and unable to have those relationships that are consistent over time. They may also be very self-absorbed. They're very into what their own response and their own experiences. And we'll see this a lot in parents who have had their own trauma experience, and they make big changes for their kids. They make all these things different, but the kids are still reactive. They're still arguing and fighting. There may be some difficulties with separating with teens, and the parent can get really self-absorbed that I've made all these changes and I've tried to help them so much, and they're not doing this, and they're kind of absorbed into their experience of it and have some difficulties with empathy or understanding where the teenager may be coming from. So this is a really important one to look for in families, in the parents mainly. And the last stage is integrity versus despair, and this is in later adulthood. So disruptions to these tasks end up being associated with like dissatisfaction with life. It's kind of a time of life review where you look back at what you've done, what your life has been like, and you're either very satisfied with it and feel good about it, or there's things that you haven't done or experiences you've had that are not resolved that cause difficulties for feeling good about your overall life and that kind of life review. And the other part of this can be a real fear of death. So being afraid that bad things are going to happen, or how is this going to play out, and who's going to be there, especially if there's family disruptions and there's like not close formed loving relationships. In this one, you want to look for in the previous generation to the parents, so the grandparents, because if there's a dissatisfaction with life, fear of death, and the relationships are still intact and they're still around each other, and the grandparents are a part of the environment, this dissatisfaction with life and fear of death can really impact the later generations who are younger. So these, even though these are in adulthood and we're looking at child development, we do want to look at these when we're working in the context of a family. So additional areas that you may want to look at, there's several of them. Rapprochement is the period of time, it's usually around 2 to 3. It is linked in with tantrums, where the child learns that you can separate and have anger, you can tantrum, you can be just kind of not be angry with your parent and have a behavioral fit, and you still love them and they still love you. So it's this combining of those two opposites. And if this sounds like a dialectical, it is. And this is where, when people have really polarized or black or white thinking, it could be linked to not having made this way of synthesizing that love and anger can coexist and can go together. So you want to look for that in the families, because you may have a parent that gets so angry that it's very severe consequences and may really have significant negative impacts on the relationships, or the kids may run away or may leave because they can't hold this tension of those two things that look like they're opposite. Tantrums, those wonderful things that should be happening between ages 2 and 3, a little above 3. These are extremely important to know if the child you're working with has had tantrums during this time. So a lot of parents will say, I don't know what happened. He never had tantrums and he was such a good child. And then now all of a sudden in elementary or high school, there's all these problems. Tantrums are a normal, natural thing that kids have to go through in order to develop frustration tolerance and to help develop that rapprochement where love and anger can go together. So if they don't have them when they're between ages 2 and 3 or around there, they have them later and they are far worse. So they are much more volatile, angry. It's more disruptive to the parent-child relationship. So this is a really important thing to ask a parent. Did your child have tantrums between ages 2 and 3? And if they didn't, this may be the root of what's happening. So you have to get some strategies to help them to get through those rough times where there's a lot of conflict. Another area to assess is the biological impacts. And this we would probably likely refer to a child development clinic or to an occupational therapist or a medical doctor. So these are autoimmune type of difficulties, sensory processing and integration difficulties, and just medical vulnerabilities because of the biological impacts of stress. You also want to look at emotion identification and emotion regulation. So a lot of children who have grown up in really volatile, traumatic environments they don't recognize or know how they feel, so they don't know how to cope with it, and they don't have the skills or strategies because they don't really know what they're dealing with. They just know they don't feel good, or they don't feel anything because they're quite numb. And emotion regulation, we obviously want that so that they can cope and manage with the emotions that they can identify and that they are experiencing. So this is another really important area, and it is tied in with that regulation and attachment. Dissociation is a big one to be aware of because of the degree of impact with intergenerational trauma. A lot of times there's the only way for a child or infant to cope is to kind of check out and not be in the have present awareness, because the present awareness is pretty difficult and would be overwhelming. So their mind does this amazing thing where it just kind of shuts that down, and they don't have good memory. They have lapses in memories. They can just be kind of hard to reach. So that's a really important one to check into, and it's important to figure out how deep that dissociation goes and how much it's impacted if they're having huge tantrums and then all of a sudden will shift and they're happy and they're okay. It may be a deeper level of dissociation that would need to be directly addressed and worked on to get these impacts resolved. Of course, we have those behavioral disruptions, which are impulsivity, aggression. Sometimes there looks like there's ADHD, but it can be the behavioral disruptions related to trauma and the impacts of trauma. So when we address all these developmental impacts, we support regulation, we build that attachment, and we treat the child's trauma, there is a huge decrease typically in the behavioral disruptions because they're more regulated, they're more in relationship with a caregiver, and you've cleared out all those impacts on the nervous system from their trauma. And cognition, there are impacts on brain development when there's trauma, that if the brain is kind of hijacked and if it's in a survival mode all the time, has to protect itself, they don't develop the cognition abilities and the language capabilities, or it will shut off when they are hijacked. So you'll have a child that will be able to talk and interact, they can get concepts clearly, but when they get emotionally dysregulated and their nervous system is dysregulated, they can be dumbfounded where they can't speak, or they can't use language, or they don't know, or they can't describe what they're feeling. But when they're not dysregulated, they can do that. So it shuts down that higher cortex in the brain and can take language away. It can take reasoning, problem solving, good judgment. So we want to know executive function and some of the cognitive things, that structures and abilities that sometimes there will be a deficit, like in verbal memory, that they can't remember words and can't use language in a way that supports their learning. So we want to make sure we look at that too if we're seeing those impacts. And then the self-concept. Now, there's a period between ages 5 and 7 where kids can't fact check. They can't go back and say, oh, mom yelled at me. I was playing too loud. Mom yelled at me. They interpret that I'm a bad person. I'm a bad kid. I'm not lovable. And these beliefs go underground and operate when they're a teenager and adult if they're not addressed. And so their brain is vulnerable to developing these difficulties in self-concept. So we really need to look at that too. They may feel unloved. They may feel like they're not good enough, or they're not as good as other people, and they can't make friends. Nobody likes them. And those are really important things to be aware of, because this is a huge impact of intergenerational trauma. Now we're going to look at the next stages in the intergenerational resilience model. The next step that we take is to address the child's unresolved trauma. So the impacts of trauma on the child, we use in the intergenerational resilience method, we use interventions that are consistent across the child and the parent coaching so that there's a common language. The parent understands what the child might be doing in therapy and has a context and framework for supporting those interventions. So it creates that common language, and the parent will have more empathy because they'll understand that fight behavior is really a nervous system response rather than a bad kid or an aggressive child that has to be kind of punished or controlled because their behavior is out of control. They have a lot more empathy for the child and what the child is experiencing. So sometimes unresolved trauma can appear like it's the developmental impact. So you may want to do repeated assessments before and after therapy. Probably not the cognitive stuff, but like OT assessments sometimes are really good to have an OT do them before and after therapy so that you can see the impacts and if there's any lingering things that need to be worked on as well. And it kind of depends on the therapist's preference if you like a lot of outcome-oriented measures or if you just kind of want to see where the effectiveness has been in any areas that need to be addressed later on. Also depends on the domain. So cognitive, you wouldn't retest cognitively, but you might do some behavioral, like a behavioral inventory for inhibition, externalizing, internalizing, all of those kinds of things. So you kind of get a read of how the therapy has impacted and supported the child. So the third step is to increase the child's felt sense of safety. And that felt sense of safety is within the context of relationship. And it can be really difficult for children and teens who are in families that are impacted by intergenerational trauma because of the impacts on regulation and attachment. So we have to support this development of the felt sense. This is where we stop the transmission of intergenerational trauma. If we take one parent-child dyad and we address the parent's unresolved trauma so that they can better support and attach with the child, and we address the child's trauma, develop attachment, develop regulation, and get this felt sense of safety. When they have children, it's a whole different world for them because they don't have the impacts of the intergenerational trauma. So the felt sense of safety really it's critical throughout the whole intergenerational resilience model. Really, when you get down to the basics, safety is the treatment for any kind of trauma or any kind of therapy. So this is because it's so important for regulation, attachment, development, connection. All of that is all based on this felt sense of safety. So then the fourth step is to improve the child's earned secure attachment. So when there's better regulation and that felt sense of safety, it creates the foundation to shift towards more secure attachment strategies so they can withstand being separated from the parent and coming back together without withdraw, attacking, avoiding. So it's really important for that secure attachment to have that felt sense of safety and better regulation. And it's a shift towards security in relationships is also a key factor in stopping the transmission of intergenerational trauma because they learn security in a relationship, they can offer it to the next generation. So throughout the intergenerational resilience method, there's attachment-based strategies embedded in the interventions. So this may be sufficient for some children and teens, but there's some cases where if there's significant impacts and they're deep and there's kind of a lot of different areas impacted of those developmental domains. You may need to do additional interventions like maybe theraplay, parent-child interaction therapy, all of those kinds of interventions for addressing finer details in the attachment, just to make sure if there's huge impacts on attachment, they may need additional interventions. So the last step is it decreases the behavioral impacts of the trauma. So it may be these behavioral difficulties are sometimes directly related to the trauma and attachment disruptions. But sometimes the difficulties may continue. And then you want to look at maybe a more defined assessment because it may be an additional diagnosis of something with sensory processing and integration, might be ADHD, might be developmental delays or things like that that weren't identified before. One word of caution is with behavioral interventions with kids with trauma and attachment difficulties, their tendency to increase dysregulation is really high. And so we teach kids to care about things, to develop these relationships, that that if they do things, they get good things. And then all of a sudden we take those things that we've taught them to care about, we take them away. So it really undermines the trust and the felt sense of safety in the relationship. Sometimes if the attachment has shifted to more secure and the behavioral difficulties persist, especially if they're linked to ADHD, because the interventions for ADHD are typically behavioral is the most effective and medication. We have to be very careful using behavioral strategies, but for some cases it may be necessary if there's these other difficulties, mainly ADHD. I usually don't recommend behavioral strategies even when the child has shifted to secure attachment, because they just undermine the relationship. They're not relationship oriented and they can cause a lot of power struggles, and we don't want to go there again. So in summary, the developmental impacts of intergenerational trauma, they're critical to assess and treat in the therapy that you're doing with families impacted. So it's increasing regulation, secure attachment, and trauma therapy may address these impacts. And addressing these developmental impacts, this is critical for arresting the transmission of intergenerational trauma to the next generation. So we have to be very specific in our attention and interventions related to development because they're critical for intergenerational resilience. So next week, we will be continuing our deeper dive into these 4 steps, and we'll be looking at increasing connection and family resilience in the context of trauma. And I just want to thank you. I'm going to go back over and see. There's my steady friend, Mohammed. He says it's a great topic. Good luck, doctor. Thank you, Mohammed. He is always on the live streams. We're always messaging and communicating, and he's just a great person. So thank you for attending, Mohammed. And this is Jason, one of my awesome online friends that we were in live streaming courses and challenges together, and just always just a wonderful person. Actually got to meet him in person in Alberta. So that was amazing to have some time with Jason. I'm glad you're here. And a Facebook user has asked if I can share this PowerPoint. So I do have a document that kind of outlines this. The PowerPoints I don't share because they're in Canva and they're a whole sheet of paper. They're not like PowerPoint where you can do the handout thing. So I will be posting the summary of this in the Facebook group. If you're not in my Facebook group, Resilience-Based Psychotherapists or Resilience-Based Therapists VIP members, you can message me on my Barbara Woods PhD page, and I will send you the handout in a message. So I hope this was useful. Thank you for joining, and I will see you next week.